We've got to talk about blood pressure. 1905, over 100 years ago, Dr. Kharkov, Russian guy, found out how to check blood pressure. Now, this is going to sound crazy, okay, but I'm going to walk you through it. Okay, because in England, okay, according to this, they feel that you should have your blood pressure checked once every 5 years. Okay, that's appropriate because it's really not that big of a deal. In this country, we have blood pressure checkers in every CVS pharmacy around, so we could build panic. Okay, but let me describe how you check it. You close off, you increase this pressure on this cuff, okay, to close it off. And I measure how much pressure it takes to close off the blood vessels, because when I close it off, and I close it off all the way even beyond stopping the blood, and I put a listening device there, and then I slowly release the pressure on the cuff. And then as soon as I hear this whoosh, 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 I quickly write that number down. Okay, and I keep slowly releasing the pressure, and then I hear whoosh, whoosh. It stopped, so I write that one down. Now the first one is supposed to be the output of the heart. The second one is supposed to be the overall resting pressure of the body, but we're not quite sure. Okay, so what did I just measure? Did I measure the blood pressure or the amount of pressure it took to crush the blood vessels in my arm? Okay, is this why African Americans and athletes typically show that they have higher blood pressure? Yeah. Possibly, I don't know. Okay, that's why it's not really accurate in every other country of the world. Okay, in this country, it's Bible. Okay, why? Because who funds the government? Pharmaceutical industry. If we create more customers, we create happier politicians because your money goes to support them. So, Harrison's medical textbook, the proper thing is to know when to treat and when not to. Okay, see, in a lot of the other countries, they want to make sure that you have healthy blood pressure. So when we look at this, is high blood pressure dangerous? This past weekend I went to Mexico, okay, to go to my dentist, and they do vitamin C IV, and I'm coming across the border, and inside of the car, they found out I wrote a book on how to cure blood pressure naturally. And so I said, well, you know, is high blood pressure dangerous? What do you think the couple in the car with me said? Yeah. Oh, yeah. Oh, high blood pressure is dangerous. And I said, good, you know, normal blood pressure, 120/80. That's for everybody. I know this. I listen. My doctor tells me. So then you start looking at it and you think, wait a second. Okay, if high blood pressure is dangerous, anybody work out of the gym? When you're straining, blood pressure can be 400/200. So do you see warning labels? Back away from the stair step or your blood pressure could go up? Good God, don't get on that exercise bike. Your blood pressure is going to go up. Put that pot down. Don't garden. Don't exercise. No, all of that's foolish. Okay, see what happens is, and in fact, your body's even going to adapt, okay, to different circumstances. Like if you have diabetes, like 30% of our population, the blood's thicker. If you have damaged arteries, the blood has to get through a smaller opening. Okay, so pressure has to go up. And then I said to this couple, well, does high blood pressure cause stroke and kidney disease? Survey says? Yeah. That's where your program. Good, I'm glad the program is working. Okay, but we're going to break that now. Okay, see what happens is you got an artery that's supposed to be big and healthy. If you damage the artery, okay, what's going to happen? It's going to get a little smaller. See, now going back to the cholesterol, when they check your blood cholesterol levels, where did they get the blood that they can test? Do they get it out of the arteries or the veins? I'll give you a hint. They get it out of the veins. Okay. Now this is interesting because it doesn't clog the veins. It clogs the arteries. So why does supposedly, because it doesn't really clog the arteries, but this is the medical world, okay? So we're talking ignorance. So why does the cholesterol clog the arteries but not the veins? And we're testing the blood in the veins. We're not testing the blood in the arteries. We're saying, oh my gosh, it's high. Well, I'm going to tell you right now. The arterial wall has 3 different layers. The inside layer is called endothelial lining. Anything that damages the endothelial lining is going to cause it to swell up. And if it swells up in a circle, what's going to happen to the opening? It's going to get a little smaller. So the same amount of blood or the same amount of oxygen and nutrients through the smaller opening, guess what has to happen to pressure? So let's say consistently you damage the endothelial lining. Let's say you're taking genetically modified foods, or you have Oh, genetically modified high fructose corn syrup, like that is the #1 source of calories in America. Let's say you smoke or have toxic lifestyles. You're going to damage the endothelial layer, so the more damaged arteries, what has to happen to pressure? The higher the pressure goes. Now the kidneys, they're the size of my fist. They have to filter 6 quarts of blood every 20 minutes. So if they have to filter that and you're damaging the arteries, okay, what do you think has to happen to pressure if you have less surface area in the kidneys? You got less surface area, so you got to, what to the pressure? You got to increase the pressure in order to keep the same amount of blood flowing through there, right? So high blood pressure is an adaptation to damaged arteries. So the people that have damaged arteries, they're going to have a stroke, they're going to have kidney damage. Does that make more sense? So it's not that high blood pressure is danger and evil. The high blood pressure is a clue that you've got damaged arteries. Okay, so what they're finding out now too is that you can change your blood pressure, and this is checking a student. They're doing this in England, and it's the first way to check blood pressure in over 100 years that's been new. You wear a monitor for 24 hours and it checks your blood pressure. Is his blood pressure the same throughout the day, or does it go up and down? It goes up and down. I mean, it's like crazy. So if you get a snapshot in time of where he's jabbed with a pin or having romantic relations, okay, you're going to say, wow, you got high blood pressure. If you're in Germany and you check him in the low end, you'd say, oh my gosh, you got low blood pressure. This is dangerous. See, in Germany, there's over 85 different therapies to raise blood pressure. Okay, they feel that cardiac insufficiency, that not enough blood supply going to the body is really dangerous. So what's the function of blood? Does it carry oxygen? Does it carry nutrients? Is it vital to the immune system? Does it balance pH? Okay, so which one of those will you be healthier if you lower? Okay, so if the doctor gives you a diuretic, a beta blocker, an ACE inhibitor, or some drug to lower it, say, Doc, aren't you lowering all those functions? Well, this is a standard patient. We're talking 56 years old. You can see he's got a problem there. So if he's got a problem, if he's got chronic pain or arteries that aren't healthy, and we know that if you're taking more than 3 drugs, your risk of dementia goes up, and he's on 10, okay, do you think his healthy arteries are small? Small. So his body's trying to fight for this. So what we do is we talk to him about soluble fiber to clean the arteries. We get him out of that fight or flight state. We go in, we do a post x-ray. He's straight now. You know, the nervous system is clear. He's able to breathe. And he's amazed because his blood pressure goes down to normal. And he had to fight his doctor to say, hey, look, check my blood pressure. No, I'm sorry. Once you're on the blood pressure drugs, you got to be on them all the time. Your whole life. You can't ever get off of them. And he says, well, it's low now. You're checking it. Yeah, but it's going to go back up. Can you see the flat earth technology? Of course blood pressure is going to go up. The guy might want to go to the gym. He might want to walk. He might want to carry groceries. Okay, he might want to sleep. This is insanity. So high blood pressure does not cause kidney disease. It does not cause stroke. The toxic deficient lifestyle damages the arteries. The body's going to adapt by elevating the blood pressure. Does that make sense? Yes or yes? Okay, is it insanity or insanity to alter physiology with a chemical? We know from the studies that it's nuts. Okay, but you're ingrained in a culture where the pharmaceutical industry is trying to tell you that by taking this drug, you're going to be healthier. This is truth in advertising. It's a restaurant out in Arizona. I think they got one in Vegas. The burgers are named quadruple bypass, triple bypass. Okay, they're named for what they cause. But when you look at this, I mean, you're taking things that damage the endothelial lining. Then how many people out there take a non-steroidal anti-inflammatory, an Advil, a Tylenol, a Motrin? When I'm doing the physical exam, I'll say, are you taking any drugs? Nope, don't take any drugs. I mean, I'm talking any drugs, over the counter. Oh, well, yeah, I take the Advil, but, you know, that's for good performance. You know, I work hard all day. And I'm going, oh, my gosh. Okay, so if you take 20, the average, and this was 80,000 women, 22 non-steroidal anti-inflammatories a month. I'm not even talking like 2 an hour or 2 every 4 hours, 22 in a month. So this is less than 1 a day. Okay, your risk of of high blood pressure and heart failure radically shot up. You've got an 86% chance of developing a high blood pressure. So when you go to the doctor and they check your blood pressure, do they say, are you taking any non-steroidal anti-inflammatories? Because that can cause it. Are you deep breathing enough? No. Do you have a toxic deficient lifestyle? Is your body trying to adapt because your body's intelligent? See, this is flat earth technology. These guys need to be fired. Aspirin a day for a healthy heart. Should you take it? I put these studies here. No, it's dangerous. Aspirin is the leading cause of kidney disease and the 4th deadliest drug in America. The best blood thinner out there is a mixture of 2 gases, hydrogen and oxygen. It's amazing. When they're mixed in the right form, they form a liquid called water. Now get this. It's 70% of your body. So 70% of your meals are water, okay, or water containing like plants or a plant-based diet. Your body's going to be healthy. The best blood thinner is water. So if you're not drinking enough water, drink more. That's going to thin the blood. But to take the 4th deadliest drug in America and the leading cause of kidney disease to thin blood, is that foolish or crazy?
Both.
Yeah, I think both. Yeah, or ignorant. You know, but when you look at the studies, based on the results of this study, experts say that the treatment of heart failure involving a multitude of drugs that prove to be ineffective should be eliminated as a treatment option. I know, Rob, you were thinking that ineffective drugs were good. I know. I know. But you start looking at this. I mean, when you read these medical studies, you think this is nuts. Okay, then you look down there. No difference, irrespective of the cardiovascular risk of aspirin use. The Journal of the American Medical Association. There's no difference. So it's the 4th, I mean, if this saved lives, I would be passing it out. It's the 4th deadliest drug in America and the leading cause of kidney disease with no benefit. With no benefit. Then we got epigenetic changes. You control the gene expression. You are not a slave to your genes. If you have Down syndrome or blue eyes or brown eyes, those are not going to change. You can control cancer genes, you can control diabetes genes, you can control all the other genes. You're controlling it by what's called genetic expression. We know this. We've known this for 30 years. You have a control above the genes. It's called epigenetic control. What this is dangerous, it says that every pharmaceutical product out there, that means every drug that's designed to alter physiology, you're literally altering your chemical processes you're altering your physiology using a chemical. I mean, would you go to a zoo and give a bear a blood pressure drug or a lion a cholesterol drug or a giraffe, you know, a diuretic? I mean, no, this is foolishness. All of these drugs, and we're looking at blood pressure drugs, anti-inflammatories, contraceptives, can cause heart disease, cancer, mental disorders, obesity, leukemia, bipolar disorder, schizophrenia. Do we have a population now where this is rampant? The drug use is rampant and the diseases from the drug use is. I love the quote from this. Consequences for modern medicine are profound. Because it would imply that our current understanding of pharmacology is an oversimplification. It is. Does anyone know how an antidepressant works? The selective serotonin reuptake inhibitor, right? Yeah, that's not true. Okay. No, that's what the TV tells you. And thank you for playing. No. See, because they say they're selective serotonin reuptake inhibitors, but when you look at the clinical pharmacology, the mechanism of action is unknown. We don't know. We haven't a clue. We think it slows down serotonin uptake, but we don't know. Anybody know how Tylenol works? We don't know. That's the deadliest drug in America and the most prescribed. We don't know. So if we don't know how those work, I mean, this is just insanity. The Helsinki Businessman study. This is a brilliant study, okay? They took 2 groups of guys, followed them for 15 years, okay? One group, they treated fantastic. Saw them like 4 times a year, gave them every blood pressure drug, every cholesterol drug you could imagine. The other group, they saw them like once a year. They just gave them advice they didn't think they were going to follow. Smokers in both groups, everything, both groups were the same. What they found, the cause of all deaths were double in the treated group. However, coronary deaths, the ones that they treat the blood pressure and cholesterol drugs, were 4 times that in the drug group. Now, remember, the pharmaceutical industry runs the world.